Well, there are no cuts. I think there's a line being drawn between reducing staff and a cut. So,
that the state of Health New Zealand's books have been used to justify cuts to New Zealand's health service. That is the issue. And that's why it's a great public concern to find out that you've been taking such creative approaches to have a very unusual report where you have to have a letter of comfort, and that the Auditor General has had to make you turn around 2 major accounting provisions.
no, that's not the case. It may be frequent in audits that there will just be disagreement about provisions, but I should say, Chair, there's no cut in services. That is totally incorrect. There's an over-expenditure against budget. Actually, if you have a look at the service deterioration over the recent years, we are trying to make improvements on that. There is no cut to services. The organisation has expanded.
That.
Well, tell our communities
Tell the National
that.
Public Health Service.
Should we let him speak, please? I'd ask you not to jump in over that.
Yeah.
Apologies,
Thank you.
Chair. Hard one. Apology.
Well, there are no cuts. I think there's a line being drawn between reducing staff and a cut. So,
And then
Thank
Cameron,
you.
and then Jenny.
Thank you, Commissioner. Given your comments just now, including that there are no frontline cuts, do you accept that the public might have a perception that the books are being cooked to support a manufactured crisis? A perception, I'm not asking if it's a fact, but
Point
do
of
you
order,
accept?
Point of
Mr.
order,
Chair.
Jenny Marcroft.
I thought we'd traversed this already. Allegations like that are inflammatory.
I'm
And
happy to
even using the
withdraw
word
that,
perception in front of it still stands as an inflammatory
I'm
statement.
happy to withdraw that, Mr. Chair.
Thank you. And
Do you
look, I will just make a comment on that. If we want, I said it before, please don't do it. We're verging into being a little bit disorderly here. Please don't do it again.
It's very difficult, Mr. Chair, to reconcile comments like there are no cuts when there's a huge public interest in that. And so I am asking for the Commissioner's.
I will just say
view.
that if you're accusing people
I'm not
or
accusing.
implying or making
It is a
suggestions that
public
someone is
perception.
cooking the books per se, look, that has a whole lot of criminal intent
I
and
will withdraw
consequence
that.
behind it. You have also made a very inflammatory comment, and the Commissioner is entitled to respond to that.
So my-
I will let him continue that, and then I will move to your question.
Yeah, I'll ask Margie, because Margie was actually there during the process.
And if I just follow the respond to the annual report results, and just for context, this is the second of a 2-year establishment of a merger of 28 entities and teams from the Ministry of Health with less than 6 months implementation planning. And so the consolidated result is a deficit of 722 million. It is a result, as I've talked about before, of a number of things, including over-recruitment. And we did have a failure of internal controls, as I said yesterday to the Select Committee, with the normal handbrakes of people aligning recruitment with budgets did not occur. And I think the other important factor is that we made some accounting judgment errors about how we managed our accruals and the challenges that much of those large one-offs, those costs during the year landed in Q4. And if we had phased them more appropriately during the year, which might be a normal expectation of matching cost to revenue, we would have had a very different looking financial position in the first 6-7 months that would have led to us making very different decisions.
Yeah.
But understandably, certainly we think a very complex year to have Health New Zealand and many lessons to take forward in how we manage ourselves going forward.
Thank you.
And
Member
given,
Cleary.
thank you, Mr. Chair. Given those answers, and you've admitted to accounting errors, and given that you don't accept, or the Commissioner doesn't accept, that there have been frontline cuts, my question is, can you understand and accept why the public see that there could be a manufactured crisis designed to be able to cut back and reduce the public health services that they are entitled to, given all of the discussion this morning, including the Commissioner's own history in working in this space, the fact that the Chief Financial Operating Officer has been made redundant, given that the accounts are not complete and have landed very late, and all the other shroud of mystery around this, can you understand why the public feel that there is a manufactured crisis being used to cut services?
Well, I think that you raising the fact that it's a manufactured crisis, it is not. It'll be interesting to see, as I say, we get a neutral third-party independent expert review of all of this to see exactly what it is. The reality is there's a loss of financial control and the result was inappropriate. We have now getting basically the impact of this run rate deficit. I can't say that enough. That is the actual problem.
Okay, Hannah London,
I have a build-up of 4 supplementary questions now because of the question lines
you
that
may
have
go
been,
for
delivered thus far. And my first question is in relation to comments made on the morning report this morning by our CEO in relation to living within our budget and the current context that our health system sits within. But really considering the 1,500 odd job cuts to date, that decision and thinking about the reset plan that's being implemented, knowing how essential it is to have strong frontline, if those 3,000 nurses weren't there, what will that look like? Because from my understanding and hearing from the frontline, every nurse counts right now on the floor. So if we've overstaffed the health system by over 3,000 nurses, what will the landscape look like for us in community?
Great question.
Just two clarifications. We're actually in consultation, so we haven't made decisions yet about jobs or impact. The point of consultation is to understand what the proposed changes might mean, including how they might impact on services that are adjacent to the consultations. I don't think any service would ever say we don't need more nurses or but the reality is we are ahead of budget.
Thank you.
I will
Supplementary
just
again.
quickly note that we do have a section on
On
workforce.
workforce, yes, absolutely, but we discussed this in this section as well. So my next question is in relation to the Māori appropriation and knowing that Hawara Māori appropriation is retained, which is good news, but of course you need staff to deliver that. Now, in terms of the changes in the reset plan that is proposed, we've heard from both the Commissioner and the Minister around the centrality of the Māori Health Advisory Committee being the group that will provide that advice to the machine, being Te Whatuora Health NZ, Minister and Operations. So what is the role of the Māori Health Advisory Committee in providing support to you in this space as you reset our health system? And have you received advice in terms of the impact it will have on Māori health outcomes?
Do you want to start, Lester? Because you've met with
So
them.
we've been, we do meet. There's a number of advisory committees that we're in the process of either setting up, some like this are established, and seeing how they're going to work together and how they're going to provide advice. We expect to have all of that work completed before Christmas. And then these groups, including and especially the Māori Health Advisory Committee, will be active in providing us advice on actual issues that we face.
So just to point of clarification, the Māori Health Advisory Committee has yet to be consulted on the proposed changes?
We have talked in general terms.
General terms, so nothing specific to date.
Koera. Start the clock.
Hey, come on, it's almost lunch, just behave yourself.
Commissioner, a New Zealand health plan is a statutory requirement of Health New Zealand. Last time you appeared before the committee, you said we would see at least a draft version. We have not. And we're advised today by the Auditor General's Office that they have not received a fully costed health plan from you either. Why is that?
So the health plan, the organisation was waiting for the general policy statement. We are pressing for us to get a costed health plan, but that hasn't yet been possible. Margie will address that.
The Auditor General has a draft of the plan. It's
Well,
not
my question was
costed to the
why?
level that and it's late because we are, the GPS, we've had to rework the activity that we can do, and the point of being costed is to assure ourselves that it's affordable. And so it
Plans a
took us
very
longer to do that.
important form of the public and Parliament knowing the activity that you're spending your money on. But we hear there is a reset plan that is not publicly available. Commissioner Levy, when will you release the reset plan
Reset for the, what was you call it?
that you referenced earlier?
Reset for the cuts that aren't cuts.
Yeah, well, we have not released the reset plan, but we would consider that.
And supplementary, the annual report from the Ministry of Health discloses that you are considering a new operating model. Why is documentation on that not available publicly?
Well, that is central to the reset plan.
Commissioner, can you see our frustration that your accounts are presented late to this, to Parliament? We don't have any information on what you're doing. Thousands of jobs are being cut.
Kia ora.
And yet you come at the beginning of this hearing and lecture us about talking about anecdotes when you're not releasing any data on what you're doing.
Well, I've been in this role for 4 months. There's a lot to do. We're trying to do as much as we can in a shorter period as possible. And we're trying to get the health plan costed. The organisation hasn't been
We have
able
the
to
same
do
management though.
that. So,
These are your statutory obligations.
yes. Yeah, and
Well,
we're
can you
trying to
do
get-
them?
Point of order, Mr. Chair.
Point of order.
I think the question should be
Carlos.
referred to the chair. She have been asking 4 supplementary questions, without referred to the chairs.
Very good observation, Carlos. And I will reiterate that people please come through the chair. Look, it's just nice and easily it flows. I'll be respectful of you, be respectful of me, and we'll make it all happen well. Thank you.
Miss,
Supplementary, I should be.
the issue is that health services are being cut, people are losing their jobs, and yet these important plans about where we're going are not in the public domain. That is the fundamental issue to the lack of trust, and why when you're breaching your statutory obligations to tell the public and tell Parliament what you're doing, that is why people don't trust you.
Well, health services aren't being cut. We've said that before. We would release the reset plan. I'm just saying again, I've been here 4 months. There's a lot to do. We've had to deal with a massive amount of inherited issues, which we are still dealing
Have the
with.
same management.
And, well, not entirely, but we will release the reset plan. We'll do that. We believe that within 3 years, we can get to a no deficit budget. And we would like to, within 2 years, be able to have made a serious dent into waiting times.
There was a disagreement with what the Auditor General's office explained was a pretty standard idea that costs should be assigned to the year in which they occur.
I'll speak to the redundancy provision, which I think we agreed quite quickly with the Office of the Auditor General. We couldn't comply with the standards and we withdrew that provision. We're now incurring the redundancy costs in this year, so they're being paid out at the moment. With regards to the Holidays Pay Act.
Well, if I could
the-
interrupt you there, the idea that restructuring that hasn't been announced, that employees don't know they're losing their job, should be accounted for in the financial year before it happens. That's pretty creative accounting, isn't it?
No, I think there was there's a lot of discussion when we came in and looked at the accounts, that you're correct, that because we couldn't announce it and couldn't comply with the obligations under the various measures to consult, it wasn't appropriate to put that provision through, and we withdrew it.
And we believe that there was a case to be made for the redundancy provision. That case wasn't accepted, so we withdrew the provision. This is standard that in the unaudited management accounts, you would have your perspective. If that's not accepted, then that's not accepted.